This week is National Eating Disorders Awareness Week, which is a time to bring focus to eating disorders and connect people with life-saving support. That support is essential right now. The National Eating Disorders Association says calls and messages to its helpline rose drastically over the last year. Alex Valverde tells us how those affected can get help during this difficult time as she continues our coronavirus coverage.
For those struggling with an eating disorder, finding help through the National Eating Disorders Association, or NEDA, is a click or call away. And that easy access proved helpful over the last year.
Starting in March, we had a 40% increase in our contacts accessing support from our national helpline.
Lauren Smoller, NEDA's Senior Director of Programs, also says contacts reaching out over the chat messenger rose 85%. Smoller says they weren't surprised with the increase given the mental health impacts the pandemic brought. With in-person programs, groups, or therapy sessions shut down early on, she says people were looking for new support or treatment systems.
There were also people who may have previously been in recovery who were finding that they now needed some additional support with everything going on, as well as people who may not have previously reached out for support before. They may not have been aware that they had a problem. And with the pandemic and the additional stress, recognize that they really were in need of some additional support.
Smoller says another thing that's contributing right now to eating disorder struggles is the rise in virtual meetings means we're online more and exposed to social media posts with altered photos and messages that may not be body positive. However, on the flip side, virtual therapy has helped people who found it easier to access the support they need by eliminating barriers like travel. And Candace Tufano, a registered dietitian, says being home more can make it easier for household members to see the signs of an eating disorder.
Skipping meals or skipping snacks that they were previously interested in, hiding food, doing any kind of secretive behavior around food or eating.
NEDA has even set up a COVID-19 page of resources and forums to connect with others, showing that during a difficult time, support is still there. Alex Valverde, LEX 18 News.